Good morning, everybody, and you're all very welcome. This morning's presentation is about nursing, a career in caring, Trinity College, the college of choice. The School of Nursing and Midwifery at Trinity College Dublin, as you can see from this diagram, is situated within the Faculty of Health Sciences at Trinity College. And this confers several advantages on nursing students in terms of academic development, sharing of teaching, sharing of research, as we work alongside other healthcare professionals such as pharmacists, dentists, and those involved in medicine. In this presentation, we're going to talk about nursing programmes provided at Trinity College and consider why one would think about studying nursing at Trinity College. We will also focus briefly on opportunities for postgraduate study at Trinity College and point out that Trinity College is recognised internationally as Ireland's premier university. It is also a centre of excellence in healthcare, education and research. In terms of your choice of Trinity College for your nursing career, it has a city centre location. And very fortunately, and students like to feel part of central college life, it's only 5 minutes from the main Trinity College campus. There is easy access to and from the city centre and also nationwide. We have very modern teaching facilities and technologies, and we have a state-of-the-art clinical skills laboratory based in the Trinity Centre of Health Sciences, which is at St. James's Hospital. In terms of staff and student numbers, we have the largest School of Nursing and Midwifery in Ireland. Our total student numbers are over 1,300, with just over 1,000 of those students being undergraduate students, and over 230 of those being at postgraduate higher diploma or PhD level, and 46 undertaking postgraduate research. We also have a large staff cohort to support students, in total 111, 81 of which are academic or teaching staff and 30 support staff. At the end of the programme, you will be conferred with a professional honours degree in one of the 4 branches of nursing, if nursing is your choice, of either general, psychiatric, children's and general integrated or intellectual disability. We also run midwifery programmes. The School of Nursing and Midwifery Trinity College Dublin delivers the programme in very close partnership with the clinical services, that is the hospitals and community services that provide the care to the clients in Ireland today. We also work closely in some areas with service users and groups to provide information and inform curriculum development and ongoing programme quality initiatives. The services provided to clients in Ireland that are linked to the School of Nursing and Midwifery are provided in the following hospital and community sites. Firstly, the Adelaide and Meath Hospital in Dublin, which incorporates the National Children's Hospital in Tala, Dublin 24. We are also linked to St. James's Hospital, James's Street, Dublin 8, the HSE, Dublin Mid-Leinster, St. Patrick's Hospital, James's Street, Dublin 8, Stewart's Care, Parmastown, Dublin 20, and the Sisters of Jesus and Mary, Monastrevin, County Kildare. The programme structure, if you are accepted to study at Trinity College in this school, will be provided with what we call a modular programme. In this programme, we teach in a shared way, firstly. That means that whatever branch of nursing you have chosen to study, you all come together in a room similar to this to study some topics that are of interest to all of the nursing students. Then we also teach you in a way that we speak about as discipline specific. So it's specific to your discipline. So if you're an intellectual disability nurse, well then you would receive content for that discipline to inform you as a nurse in practice. And if you're a general nurse, that discipline specific content may be slightly different and you're taught then separately to the rest of the group, in your own group. The major subjects include nursing, biological sciences, psychology and sociology, and there also are a range and variety of clinical placements and internship. And each year of the programme is a mixture between what we call blocks of theory, so you'll be sitting, as it were, in the classroom for perhaps long periods of time during the day and during the months, learning about how to be a nurse and learning the skills required to be a competent reflective practitioner. But then we also have periods or blocks of clinical placement where you will be placed in a specific ward or community or hospital area linked to your discipline or required for your discipline. At the end of the programme, successful students are conferred with a professional honours degree in nursing from Trinity College Dublin, and also they are able to register as a nurse in the relevant division of the Nurses Register with the Irish Nursing Board, which is on board Altrincham. We provide a range of teaching methods to students in the school. Firstly, there are large lectures in a room such as this. We also have interactive class discussions. We have clinical skills training, so training in the skills required for the practice of nursing, for example, laboratory simulations. We have group work, tutorials and seminars, self-directed learning, problem solving, and of course the very valuable practice placements in first, second and third year. In the final and fourth year of the programme, there is a long period of what we call internship, where you as a student work very closely with the staff at the sites in order to develop your ongoing independence and competence required to register ultimately as a practitioner. There are a range of assessments and examinations across the programme that are required to satisfy the Nursing Board on board Altrincham, European Union requirements and the college requirements in terms of satisfying those bodies and the public that you are fit and competent to practice as a nurse. In order to assess this and find out that you have the required knowledge and skills and competence, we assess a variety of theoretical and practical elements. In the theory perspective, we use multiple choice questionnaires, so short examinations, written examinations, coursework, case presentation, and the final acronym there is OSCE, refers to Objective Structured Clinical Examination. And as you can see from the photograph, one way that this can be done is by the nursing student performing the clinical skill, and outside of your view there is an examiner examining the skill in an objective way. So rather than you writing about your performance of the skill of blood pressure taking, you're being observed by a trained assessor to ensure that you actually have the competence requirement. So very much hands-on in these photographs. One photograph you can see perhaps an actor maybe taking part in this, or in the other photograph a mannequin. And these OSCEs are used to assess elements of clinical practice. We're very fortunate at the School of Nursing and Midwifery, Trinity College Dublin, that we have a range of supports for students on the course. Firstly, the practical experience that I mentioned to you out in the clinical areas has a range of support, starting at the closest level with the staff nurse, the qualified nurse or midwife that you would be working with, who would supervise you in the early stages of your programme and later stages to a lesser extent as you become more independent. The staff nurse, there are a range of staff nurses available to you who will be working in a day-to-day contact with the clients that they're caring for, but a specific staff nurse will act as what we call your preceptor. A preceptor is somebody that supervises and guides you in the clinical area towards achieving your competence as a nursing student and ultimately as a nurse. There are also clinical placement coordinators in many of the large hospital sites, and these are staff specifically employed with a remit to develop practice and also to support students. So you have specifically designated staff there engaged in the ongoing support of students who are received in a very positive way by students and do very good work in this regard. Working closely alongside these clinical placement coordinators are nursing midwifery practice development staff, who are also involved in not only the guidance of students and support of students, but in this linkage to the university site and this partnership, close partnership that Trinity College has with all of its linked sites. At the school level then, in the classroom, the lecturers who provide the teaching to you provide support, direction, guidance, management of the course. Each of the topics and subjects, as I previously mentioned, are delivered within modules, and each of these modules has a leader who is able to provide you with advice and guidance on your studies. Students in all years, and for yourselves, hopefully joining in first year in September, junior freshmen as we call it, there are course coordinators. These are staff appointed in the school specifically to guide and direct and manage the programme for you, and these are excellent resources and points of contact for you to receive information and find out about the course, and also to manage the course on a day-to-day basis. And as you can see, there's quite a lot of support for students at these two levels, and possibly sometimes less visible to you on your day visit are the college supports, and these are very, very far-reaching, and there are a range of supports, excellent supports that Trinity College provide to students. Firstly, we have a college tutor system, which is excellent. Every student who registers at Trinity College is assigned a name of a academic staff member who would actually provide them with support. This support can be academic support or referring the student on to other services in college, such as the Student Learning Development, which is the next title there. And these are a range of supports provided to students who like to know more about study skills, exam answering, essay techniques, and so on. There is also a very good disability service within the college. We have student counselling, we have health service, we have chaplaincy and mature student support, and there are also financial supports available. We have a very extensive library, and from a nursing and midwifery perspective, we have a subject-specific librarian who provides very good support to the staff in the school and to the students in terms of seeking resources, letting us know about particular resources, and of course the books and electronic resources and journals that the nursing and midwifery students require are very, very extensive and provide a great support to students. So a little bit more about the types of programmes that are provided. Firstly, general nursing. The training as a general nurse gives the graduate the knowledge and skills to provide nursing care in a variety of hospital and community settings. At the end of the course, the graduate will have the knowledge and skills to practice independently or as a member of a multidisciplinary healthcare team. These nursing graduates are educated to nurse patients with acute and chronic illness, including medical and surgical conditions across the lifespan. The degree programme emphasises the development of professional competence, caring, communication and understanding of the patient's needs. Psychiatric nursing graduates are educated to nurse clients with acute and chronic mental health problems in both community and hospital settings. The degree programme emphasises the development of professional competence, caring, communication and understanding of the client's needs. Approximately 1 in 4 of the population experiences mental health problems. The objectives of psychiatric nursing are to facilitate the maximum development of the mental health of the individual and to promote mental health. A major focus of psychiatric nursing is to facilitate and promote recovery for clients so that they can live full lives in the community and to support those already living in the community. Intellectual disability nursing. Intellectual disability nursing graduates are educated to nurse clients with a range of intellectual disabilities in both community and residential settings. This degree programme equips the graduate with the knowledge and skills to provide stimulation, practical support and nursing care for persons with an intellectual disability of all ages and abilities. Nurses who work with persons with an intellectual disability have a diversity of roles, from intensive physical nursing of individuals with profound disability to supportive guidance in helping children, adolescents and adults to live their lives of the highest quality. Children's and general nursing, integrated. Children's and general nursing graduates are educated to nurse both children and adults with acute and chronic illness, including medical and surgical conditions across the lifespan. The degree programme emphasises the development of professional competence, caring, communication and understanding of the children's and adults' needs. The Children's and General Nursing Integrated Degree Programme is 4.5 years in duration and grants eligibility for dual registration in both the children's and general divisions of the Nurses' Register. Children's and general nursing students undertake an integrated programme combining studies in both children's nursing and general nursing. The School of Nursing and Midwifery, Trinity College, awards a number of prizes and awards. There are hospital prizes, there are school prizes such as a gold medal, book prizes, there's a college scholarship examination, there are national awards, and all of these recognise and celebrate student excellence. Questions to consider when one is asking why study nursing is nursing a good choice to make? And we would suggest it is a very rewarding professional choice. It facilitates international travel and it provides you with a wide range of skills and knowledge. It offers a wide and diverse pathway for the future. Pathways for the future involve clinical pathways, working in either the hospital or community-based services. There are educational pathways, moving into the education of others. There are administration and management pathways, research pathways, and policy formation pathways. There are also many opportunities for postgraduate studies. The school offers a range of taught postgraduate clinical courses at postgraduate diploma and master's level. There are opportunities to undertake postgraduate research training at master's and PhD level. The school is staffed by academics with a wide range of clinical, teaching and research experience. Points for entry to nursing and midwifery. The points change every year depending on the demand for places. In 2011 they were as follows: general nursing 420, intellectual disability nursing 385, mental health nursing, psychiatric nursing 385, children's and general nursing 495, and also the midwifery programme 445. The school offers a testimonial to explain patients' views of the current service. My wife had a baby girl late on Wednesday night. For about 10 hours she was in the pre-labour ward being cared for by a final year midwifery student. The care my wife received from this student was exemplary and of the highest standard. I was so impressed by the student's attitude and skills. We are often quick to criticise nurses and midwives. Not in this case. Instead, I am complimenting a high calibre student. I would just like to let you know that as head of school. Just wanted to relay an experience to the School of Nursing that I had yesterday. While attending the hospital with my son, I met with some very efficient and friendly student nurses. I am delighted to say that these young student nurses were Trinity College Dublin students who were on work experience placements, and if these are the young people who are representing the School of Nursing, all I can say is that they do the School of Nursing and Trinity College Dublin proud. I was quite preoccupied with my son as he had to undergo a general anaesthetic, but I did manage to mentally record the name of the two nurses. Both of these young people were very engaging and helpful and very eager to put my son at ease. Another girl we met was a Trinity postgraduate student, and she was in the recovery ward. She was fantastic with my son when he came back from theatre and made sure that we had all of the appropriate information before we were discharged. We hope that this presentation gives you some information about the courses and opportunities available at the School of Nursing and midwifery, Trinity College Dublin, and we hope that you will come and join us all in 2012. I'm available outside the auditorium if anybody would like to ask questions on this subject. Thank you very much.